Welcome, class, to the Week 8 presentation for ME105 Medical Terminology. This week, only one chapter. Can you believe it? It's always kind of a nice surprise, I think. We are focusing on Chapter 10, which is the urinary system. Let's start by kind of getting our brain around some of the combining forms in terms of the urinary system and what they refer to. Nephro-reno, that's going to refer to the kidney. Pylo is going to refer to the pilus of the kidney. Uro and urino, it's going to refer to urine or the urinary system. Uretero is the ureter. Cysto is going to refer to the bladder. Urethro is going to refer to the urethra. And prostato is going to refer to the prostate. Let's talk about our structures of the urinary system. So the system consists of two kidneys, which filter the blood of waste products, two ureters, which transport urine from the kidneys to the urinary bladder, one urinary bladder, and it holds urine before excretion from the body, and one urethra, which transports urine to the outside of the body. That urinary bladder is a hollow muscular organ. It's found on the floor of the pelvic cavity, and it's posterior to the pubic symphysis. The urethra is a thin wall tube. It takes urine from the floor of the bladder to the outside of the body. The term urethral just means pertaining to the urethra. Looking more closely at our kidney, the functional parts of our kidney, the functional unit that does the actual filtration is known as the nephron. And here you can see the structures that make up our nephron. In terms of some more terms that go along with our urinary system, nephrologist, we just talked about the nephron, so nephrologist, if we break that apart, probably is a doctor of some kind and of the kidney. So a nephrologist specializes in diseases and disorders of the kidney. A urologist specializes in diseases and disorder of the urinary system as a whole. Couple exam types to be aware of are procedures. Intravenous urogram. So this is an x-ray image that was taken after contrast medium, which is just the dye that shows up on x-ray that's injected intravenously. It's filtered from the blood into the kidneys, and then it highlights our kidneys as the filtering is going on this x-ray. The renal pelvis and the ureters are clearly visible, and this indicates a normal finding. When things look visible and nothing's enlarged and it looks equal from left to right. The term urogram, that's an x-ray film of the kidneys and ureters produced after the injection of radiopaque material into the vein, which is what we're seeing here. Cystoscopy. Okay, so cystoscopy usually involves a urethroscope. This is the instrument used is a cystoscope. This diagram shows that cystoscope in place in the male bladder. In cystoscopy, the cystoscope is passed through the urethra, thus the urethroscopy that we talked about, and into the bladder. The mucous membrane is examined by light mirrors and special lenses. Some other procedures to be aware of. Cystectomy. If we divide that word apart, we can think of bladder and ectomy, meaning removal. This is a surgical procedure in which the bladder is removed. Nephrotomy. This is an incision into the kidney. Transurethral resection. This is a procedure to remove part of the prostate, and it's discussing the transurethral is discussing the method to get to the prostate. Pyelolithectomy. Whenever we hear that term lith, we need to think of stone. Ectomy is going to tell us that it's a removal. Pyelo is going to indicate that it's the pylorus of the kidney or the pelvic region of the kidney. So this is a surgical incision of the kidney to remove a stone from the renal pelvis. Some conditions to be aware of. Bilateral nephromegaly. Bilateral is going to indicate both or both sides. Nephro, obviously we should think kidney. And megaly is going to mean enlargement. So this is an enlargement of both kidneys. Nephrolithasis, again, we see that lith, so we should think stone. This is a condition marked by the presence of kidney stones. Oliguria, that urea, we should think urine. So this is diminished capacity to form and pass urine. It's considered less than 500 milliliters per day. Glycosuria, again, we see that urea in there, so we have to think urine. The glyco is going to indicate sugar, and this is sugar in the urine. Glomerulonephritis. So this is a type of nephritis in which the glomeruli of the kidney are actually inflamed. Remember that suffix itis is always going to key you into an inflammation. Another little tidbit that's good to know is urea. So urea is a major waste product found in urine of a normal individual. And here you can see the breakdown of urine and what all is contained in it. That urea actually makes up 2%, which comes in second in terms of the most abundant. Most of our urine is water. At this point, I know it was short and sweet this week, but with only one chapter, it was kind of nice, wasn't it? This reaches the point in our presentation where it's time for you to ask questions. So if you have any areas of concern or need additional assistance, definitely reach out to me. Do read the entire chapter in its entirety. It's only one chapter this week, so it shouldn't be too bad. As always, our information presented today did come from your textbook. Thank you so much for your time. Have a great week.